For doctors, pursuing their passion can come at a high financial price. The average amount owed for those starting their careers, more than $200,000, amassed from years of college, medical school, and completing residency programs. It's enough to discourage some doctors from working in underserved communities, according to the chief medical officer at Harbor UCLA Medical Center.
You get some folks who think, I'd like to work with you, I'd like to work with this population, but I just can't afford it.
Yeah, and it's really tragic, and that's why they wanted to become a doctor in the first place. But the realities of a crushing debt after so much training, and then their hopes and dreams for themselves and their families when they start out, becomes a challenge for them to choose that path.
The need for doctors in hospitals like this is now leading to creative solutions.
In California, we have a shortage of physicians just overall.
Cal Health Cares is a new loan repayment program targeting physicians and dentists, helping them repay student debt up to $300,000 in exchange for practicing for 5 years with at least 30% of their patients covered by Medicaid.
Our hope was that if we can get these physicians and dentists into the program, they will establish their practices, they will see how beneficial it is to be in our program, and that they will stay on long term.
Pediatrician Tanisha Moss began her career $250,000 in debt.
I was willing to go to school and whatever the cost was, and not until after I graduated and I realized exactly how much it cost and how much you have to pay back did I realize it required a lot.
Of the 1,300 Cal Health Cares applications submitted, just 278 doctors were selected, including Dr. Moss.
It feels like a weight lifted off my shoulders.
Program coordinators say it's a start. With 5 rounds of initial funding, from a voter initiative to tax tobacco, they hope to keep it going.
Are you concerned that after the window expires that some of these folks will leave?
It is a concern, but what we find is that when physicians start their career serving Medicaid patients, they often end up keeping that as their career.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.